All right, we are live. Hello, everyone. Thanks for joining today. Greta should be joining us in a minute, folks. She's having a little technical difficulties, but I am here. I am Dr. Bryant, and the pet travel expert, and I am here with Dr. Azza Diasti. I'm sorry, did I say it right?
Yes, correct.
Thank you, dear. She is our guest for today. I'm very excited to have her. And before we get started, I'll introduce myself, and then I'll actually introduce our guests as we're going along today. I'm Dr. Bryant. I'm a veterinarian, and I work in the airline industry. I've been working with Delta Airlines since 2018 timeframe was when I started during summer. And I was brought on staff initially to help review and revise the policies of animal transportation. And you might wonder, why would an airline need that? But actually, it's very crucial and important role. A lot of airlines transport animals, and I'm not sure if you're aware, but there's a lot of regulations behind the transportation of animals. And I'm talking more than just your dogs and cats. I'm talking about your zoo animal species, live tropical fish, day-old chicks hatching eggs, what have you. There are regulations out there. And in the U.S., it makes it complicated because, guys, not just one federal agency regulates the transportation of animals. So you've got USDA, you've got the Centers for CDC, which Centers for Disease Control and Prevention. You've got U.S. Fish and Wildlife Services. They take care of a lot of wildlife and other exotic animal species. So it's very complex and everything. So that's why I was brought on staff with that. But while in that role, I started noticing that as far as traveling and gearing towards pet owners, I felt there was a lot of education that was lacking to help better prepare pet owners and the pets for traveling by air. And I sit in cargo, so a lot of things I see are related to cargo. So I do focus on that, I'll be honest with you folks. But I started When Pets Fly to share pet-centric travel education to try to help my pet owners and their pets getting to their destination safely. So I developed When Pets Fly in this platform, and we've done a lot of different things with it. We have social media presence with Facebook, LinkedIn, Instagram. We have a YouTube page, not developed yet, but we have a YouTube page too. And we have just been growing. We also have a website. If you ever have any want to go to and look for a lot of information, and that's grown over the years, but that's whenpets.com. So definitely check me out on there to learn more pet-centric travel education for your pets. What I do on my Facebook Lives and what we've been doing these past few years is that we introduce different stakeholders in the animal transportation industry, and I've met so many unique people over these past few years. Today, definitely want to have Dr. Azza Diasti with us today, and she's going to share what she's doing. So actually, you know what? Let me do a little bit. Why don't you introduce yourself, and if there's anything you missed, I'll add in there. So if you can, Dr. Azza, please introduce yourself.
Hi, my name is Azza Diasti. I have been a veterinarian in Florida for over 20 years. And I owned a couple of clinics in the Tampa Bay area, and I was practicing vet medicine almost, as you know, 7 days a week, on call on the weekend, and doing surgeries and seeing clients and all that stuff. And right now, I created an online platform that connects pet owners with licensed veterinarians and can have an access to trained EI. It's like having a vet nurse with you, holding your hand 24/7. So that's what I do. I'm devoting my life to literally make pet care affordable and accessible to a pet owner and empower them.
That is awesome. So also, what she forgot to tell you is that she's more just a veterinarian. She also earned an MBA from MIT. And so she's combined her veterinary expertise training background with, say, innovation and technology to develop Vetzi. So that's really, really important. When did you finish your MBA with MIT?
So after I sold my current, my clinic, I decided I was so passionate on providing veterinary care 24/7 to pet owners and being affordable and accessible, especially online. But I wanted to leverage technology. So I said, I'm a veterinarian. I'm not like an engineer. So I think I probably should go back to school. So I decided to go back and do my MBA at MIT, where I can have this amazing network of very brilliant engineers and the latest technology, and learn from them. And that happened. I started 2019 and I graduated in 2021. And while I was there, I was testing the concept. And then COVID happened. And then the idea was actually there was a little more acceptance to the idea for virtual care online. So that helped us a little bit. And we tested several models because state laws didn't allow us to do virtual care. So we had to do like recommendation and advice. But now we updated our service to actually diagnose and treat online as well in the states that allows virtual care.
Right. No, that's good. You know what? It happened all, I guess you could say, perfect timing with COVID and everything. Because during that time frame, I was also working in practice a little bit, and there was so many constraints on how they did things. It was so rigid. So really, for pet owners to have the ability to use telemedicine or telehealth really was a huge
remember during COVID, we didn't allow clients to go in the clinic. It was a curbside. Everything was a curbside. So if it's a curbside, we could have just done it online,
It was I don't think folks really, well, I guess you could say some pet owners that of course continue with their veterinary services during the time for their pets, but they didn't realize what was going on the inside with us, but we were so kind of restricted. We only saw the pet, and God forbid if there was a potential exposure. Say they said, oh, well, the pet owner had COVID. So then you put all these geared on, PPE on, and covered up just in case, because you just didn't know what was going to happen. So you just wanted to protect yourself.
Yeah, we lived in isolation, like the isolation, gears all the time. If it's so it was a tough time. But this is when virtual care really started, and people started to accept it a little bit more and say, oh, actually, we can get a lot of things done and a lot of questions answered through virtual care.
So, well, you mentioned a little bit before we came to session, though, this actually helps in a way you were saying as far as quality of life and being able to still serve as far as giving veterinary services or advice and helping your clients and everything with their pets. It also gives you kind of a work-life balance where you can kind of do both things, where you're still doing it in the veterinary profession, but you're a little bit different.
You're absolutely right, Dr. Nelva, because as you know, majority of veterinarians are female. I think it was like about 89% or 88%. I don't know exact number, but most of the vet providers or veterinarians are female. Even the vet staff, honestly, majority are females that looking for flexibility and work-life balance. And for me, I had the children, I was raising them. I was like living in my clinic 7 days a week, running the business, taking care of clients, doing surgeries. So I would have loved if I had a platform that I can join, still practice what I'm passionate about, what I love for a couple of days, and then maybe go in a clinic for 2 days, like do a surgery one day and see clients one day. So this way I can also have time for my family or for myself, but veterinary, as you know very well about also the suicidal rates and the stress. Our job is not easy. It's so stressful. And we have to have balance, because if we don't have balance, the mental illness that all the professions like, in veterinary medicine, dentistry, physicians, it's not an easy thing. So sometimes having a platform that you can just educate and help and with a compassionate, guided advice, sometimes it's the stress of dealing with the crazy day at the clinic and all that stuff. So and this is all what I was thinking about when I built my platform.
That's wonderful.
It's like really catered not just to mostly women, but also men and women, and also to retired. Like if like somebody's retired and want to do a day or two, because he loves to educate and he loves to keep their skills up, and they gain so much knowledge over the years. So a lot of us 20, 25, just like mine, 30 years. I still
Right.
want to give the knowledge that I gain to my clients, but I don't want to commute for 2 hours to go to a physical clinic. And I still want to offer and share my knowledge and help and empower pet owners. So this is like Vetzi is such an important platform to provide and fill up the gap that is missing. So as you know, we're not replacing our in-person or our clinics or ER. We're just filling the gap and empowering pet owner by educating them and make better choices.
Well, I love it because I always say that what a lot of pet owners make the mistake of doing is they'll go to Dr. Google, and they'll type in whatever. And sometimes even with the AI systems that are out, you got Copilot, Chat, GPT, you might get information, but if you don't know how to apply that information, you really, it's overload in a sense.
100%. It's not
Overload.
very specific to your case.
Yeah.
So
Yeah.
what we trained, it's not like our Vetzi AI is trained by licensed veterinarians like me and you that have been in the vet medicine for over 20 years. You know what they're doing. They're very specific answer. If we can give a simple solution that the dog owner can take care of it at home, we do that. If it escalates to an ER, we have AI flags that tell owners, no, this is an emergency and you need to go to the nearest emergency clinic, and we will guide them to, according to their zip code, what is the nearest ER clinic. If they don't have an existing primary vet, we will also give them all the close by veterinarians in their area according to their zip code as well. So we're like very specific, very guided advice, right to the point. And while the vet's office is closed, or they cannot get in, or they have to wait for 2 weeks, or their cat hides under the bed, you know how that they have the sixth sense. They're going to see us, and then they're hiding for weeks.
Right.
You cannot get him from under the bed. So this is where a platform like that, like there are a lot of cats. We have over 100 million cats in the US haven't been seen by veterinarians. So this is when if the cat has an issue, instead of taking the cat to the clinic, that would be another good option for pet owner to check on the cat and ask away all the specific questions as well.
Yeah. No, this is great, and I'm glad you're doing it as far as your system. Again, it's not just a chat box. It's going to really give it guided advice in a sense. Not overload. It's maybe tailored for that particular case. And as you're saying, it can help triage it in a sense. What's most important? What can wait, and go from there, which is extremely important.
You're absolutely right. The word triage. We're seamless triage to care immediately. Because if we triage and care and make sure we give you that hold in hand kind of feel and give you the guided specific advice, and then if we feel like our online vets can take care of it, we'll connect you to our schedule right away. If we feel no, they have to go to ER, we'll connect you to the closest ER clinic. So we're not just a video call. We're a lot more than that for a pet owner. We're like all and like platform to help and support them while their vets close, or 24/7 if they're busy. And a lot of us have a busy life, so not every appointment is an in-person appointment. As you know, not every pet needs an in-person appointment.
Right.
Let's be realistic. Probably more than between 40 to 50% of the time, we can achieve all that, especially for chronic cases like arthritis, diabetes, a lot of chronic diseases like that. We can manage that online. Supplements, nutrition, behavior, questions about your travel, like that you're such an expert on travel, right? I have my pets and I'm struggling how I get them and prepare them to travel. And I have a couple of questions for you. You let me know when you want me to ask that, but I'm so curious to know. And we can even, we were training our AI chat to even give pet owners how to do all that.
Yep. Well, I'm gonna slow down a little bit because I know we're saying a lot of valuable information in a short period of time. Let's just slow down a little bit and just say, honestly, I think what you're doing is amazing. It is a definite need. Um, and it's what people need as far as that. And the interesting thing about it is, as you mentioned a little bit earlier, as far as telemedicine, or is it telehealth? I don't know. Actually, tell me, what's the correct term for what you're doing? Telehealth, or is it telemedicine?
Telehealth is if, when you're given, basically there is an advice and recommendation, but there's several states are allowing now virtual telehealth. So we have our licensed veterinarians. If our Vetzi chat cannot help, we kindly tell the pet owner, hey, I think you're going to have to meet with our licensed veterinarian per state. So, and we follow the state regulations. So in Florida, they're allowed the virtual care, and we're allowed also to do certain prescriptions, temporary refill of some medication like heartworm, flea stuff, supplement, antibiotics, until we get them to their primary vet.
Okay. So telehealth. Yeah, you're right. So besides Florida, I know you're in Florida, which is great. Can you think of any other states?
Yeah, there's about I cannot name them all right now, but I think almost like about 11 to 12, almost about to, we can actually, and that's part of our vision, hopefully.
Okay. Yeah, I know I've seen some things where there's certain states that are against it. So it all depends. And I guess I can understand it because there's a worry behind the need for the doctor-patient, the client-patient kind of relationship. First, I know there's a lot of situations, I'll tell you, when in practice, where someone will say, we were prescribed such and such medication. This one veterinarian did it. Actually, you always see this in a Banfield setting. They'll say it was prescribed by Banfield, but it was unfortunately prescribed by a certain veterinarian. And they'll say, well, we need a refill, but the refill now is expired. It's like, well, we need to now develop another doctor-patient relationship with your pet to dispense further medication and everything. And the sad thing is, again, they assumed it was distributed or signed off by Banfield, but it's actually signed off by that veterinarians under their license for that particular medication. So you worry about in these situations, do you have to have the doctor-patient? Again, there's some instances where you might have to dispense medication, but you have to have that relationship to dispense anything through telehealth, right?
If they come to us, like, we're allowed to do a virtual care, like a virtual care visit now in certain states. State allows us to do a visit, and we can, send very limited and temporary refill on certain antibiotics, like 10 days instead of more, 1 month only of heartworm or flea medication. Let's say that the pet owner cannot get to their vet because it takes weeks and they're infested with fleas, and they desperately need some flea medication. Our platform will look at your pet, will evaluate, and will make sure that your pet can actually get the medicine or the treatment or the prevention, and we'll give you a very limited prescription until you get to your primary vet. And so we're here to collaborate and fill the gap until the primary vet or the day vet is available for the pet owners. We're not here to replace them at all. We're actually, our mission is, we're collaborating with urgent care, primary care, and ER.
I can think of some ways also during travel with a pet you benefit too, because imagine if someone is traveling with their pet and they run out, they forgot something, they forgot a medication that's needed.
I love you mentioned about the travel, especially. And also, so something also that a lot of my pet owners call me while they're in a different state. I was like, oh my God, can you please have your staff send me the medical record, all the vaccination record? My dog needs to go to the ER and I have no vaccination record. I don't have the last time he got his
Yep.
X-rays or ultrasound.
Yep.
So the beauty of our Vetzi platform is allows pet owner to upload all the vaccine record, all the history, anything that the pet got. And this way, the pet owner will have like store all their pet's medical record in one secure place. They can have
Mhm.
access to it. They can add as you go to the vet, every time they go to the vet.
Right.
You know, there's actually some apps just pay the charge owners $10 to store the medical record. So we can actually store it. We can share it. Just to log in and create create an account, and you become a member.
Well, look, I could see that for travel. That's extremely important because God forbid something happens when they're away and you want to have all that information with them. So they really should travel with the medical records for your pet. I also can think of situations where you need to
get it. Yeah, like, hey, okay, I have it in with Vetzi. They have all. I save it, and it doesn't cost anything to log in to become a member.
Folks, imagine too. Another site they would need it is folks that take their pets to the groomers and they need a recent vaccination records. That's another good thing you could use it for. Boarding facilities, if they need to go to boarding facilities, they need to have vaccine records and stuff like that. That's another 100%. Spot where you could use it too.
100%. Yeah. So that's definitely another advantage. One other thing too, like there's a lot of vets looking for an online option. We provide, as I mentioned earlier, our vets, like any vet, as a 1099 can actually become a member of our provider or vet group. Mm-hmm. They can log in as a vet. We provide the marketing, the technology, the logistics, and we charge them small fee for each visit, a very small fee, and then they can decide how much they want to charge for their vet consult. This way, we can have a lot of vets with different time available on our platform so they can empower and support our pet owners. So the veterinarians are benefiting, but also that gives more flexibility and more scheduling flexibility and availability for our pet owners from the other side as well. So we can actually add vet nurses if you want to not to talk to our chat Vetzi or behavior nutritionist. They can just actually become members in our platform, and they can decide on how much to charge. And once they get paid per visit, the money goes right to their account immediately, the same minute. So you don't even have to get paid at the end of the month or the end of the week or anything else like that. So it's really a platform that makes, how us, as vets, we didn't want to deal with management. We didn't want to, that's why a lot of us, I don't want to own a business. I just want to do what I love. I just want to practice medicine. I just want to have time. I don't want to deal with all this, logistics and all that, and hiring staff and fire staff, doing marketing. Right. So I just want to go on, do what I love, empower pet owner with amazing education and amazing advice. And, of course, we have to get paid for our hard work.
And then, I love you say that, because a lot of people don't realize the passion that's in a lot of the veterinarians that are out there. I mean, I'll admit there's some maybe that are not as passionate with it, but I would say this has been a lifelong dream for me. This is something since I was little. This is what I wanted to do and be. And so I'm very passionate about animals and taking care of them. I'm very passionate about educating pet owners and making sure they're familiar and aware of what to do and how to take care of their pets properly. And I love that I have this opportunity now where I can put all this passion towards pet travel, because I feel like it's an area that's just sitting there that folks didn't understand what to do or how to do things. So I said to say again, we're very passionate about what we're doing. You mentioned earlier, suicide rate in the veterinary profession. You guys don't realize how deep we take this. We love the profession, and the profession has surprised a lot of folks because it doesn't necessarily prepare us when we go through college. It doesn't prepare us for what we're doing. It really doesn't. It tells us all the technical things to do as far as veterinary medicine, but all the ins and outs, running a business, managing people, just relationships, client relationships, how that should be, all that stuff. They don't really teach you all that stuff. You have to either have it, somehow learn it or have it in you. I I think mine came from as far as because I was accustomed to dealing with people because my mom is a beautician. My mom's had the family business for years. We grew up in a salon doing hair, interacting with customers. I'm okay with. I know how to communicate with people because I grew up in that environment. But for those who didn't, or those that are just maybe medicine and just focus here, you're not going to survive in this profession if you don't have some communication skills that are inherent or learned quickly because they don't teach you that in school. So that's probably, I'm sure that adds to the pressures we have interacting and dealing with people and everything. But again, this is our passion. This is what we love to do. So I love that you found another way to kind of find a little niche in there where you can grow and see a need, basically.
I love what I 100% agree with you. We need to change. We need to disrupt our profession. We need to make it easier for us. We're not all born as business people
Right.
running and knowing how we went to vet school because we love animals, right? We had no clue, like you said, like we're running businesses, we're dealing with people. A lot of us have even social anxiety, right? How are we going to deal with that? So even being on a computer would lessen your social anxiety, right? Just instead of being in person. So there's a lot, like we need to modify. It's not like one system fits all. Like we need to also have other options for us to spread our knowledge and empower pet owners. And this is honestly another option. It's really tough. And I think a lot of people are aware of the suicidal rate that we're facing. So hopefully something like that. Like I love what you're doing for the travel. Like I have a lot of questions for you. Like even as a
you can pop them out. Let's go backwards and forward a little bit. What can I do what questions do you have?
I'm going to talk to you not as a doctor or a veterinarian. Okay. Like I have my amazing Leonard golden retriever, and we travel in the summer, and our travel is 22 hours. So for me, I want to get him in a plane. I don't want him to be in a car for 22 hours. So I want to know, how do I get on a plane? How do I prepare him? What kind of I want I don't know. Yeah, give me an advice because I need to know.
The problem, I always say the problem that people make is I'm glad you have that question because you're thinking of your pet. The most people don't really go that far as thinking of their pet and what they're going through. And they just figure, I want to go somewhere and I want to bring my pet with me. And I hate to say it, but they're almost like a tag along the way they treat it. They'll just book their flight. They know they need to get a crate for their pet, right? They also know they need a health certificate to travel if they're going by car.
Can you go specify the crate?
Yeah. I'll tell you that. Just trust me, I'll tell you. But I'm saying the things they know they need to do is a health certificate. They always say, if they you have a larger dog, so it's going to go by cargo. So you need a health certificate dated within 10 days of travel. So, they'll say they'll go see their veterinarian then, and they need to get a crate for their pet, and they'll go to PetSmart or whatever, or God forbid, they'll pull out the crate they used to house train their pet in initially and think that they can put it back into that. And that's a big no-no. So for crates, I want you to, actually on my website, I have information about it, but what you're going to do is find a IATA compliant. IATA stands for the International Air Transport Association. That's what it stands for. You want an IATA compliant crate. Luckily on the website, on the internet, you can find actually the specifications. They give that out readily for you for crates. And the container requirement for dogs and cats is CR container requirement number 1. If you find a crate that complies with that, you are good to go for traveling with your pet going by cargo. Please make sure it's the appropriate size crate as well. And you want to get this crate well in advance of your trip. Say if you're traveling, I would start sometimes for certain pets a month out, 2 months out. If you know you're going to be traveling, get them acclimated to being confined in it. And that process is, if they're normally not in their crate, knowing it's their den, you want to get them in there and maybe say not lock them in there as punishment, but get them in there where they feel comfortable. Feed them in there where they think that's their space. It needs to be their den. So as time goes on, you can close the door and you're okay with being confined inside of it. Then you're doing great. Then when you travel with them, they're comfortable being inside the crate. They're not trying to break out, whining it. They know this is their space and they're comfortable. That's what you need to do. So IATA compliant, the appropriate size. Again, don't pull out your crate that you potty trained them in years ago and then think they can fit in that because it's compliant, because it's most likely too small for them at that point. So it has to be the appropriate size. Again, comply with IATA and I think you'll be perfectly fine. If you look at the data as far as animal incidents or problems animals have during air transport going by cargo, the numbers are very, very low. And I think the last I checked, from 2016 to 2024, I believe it was around, I want to say around 190 animal incidents out of I think it was 2.9 million. So
that's amazing. So
very low number. Very low
yeah.
number. But in those
Wow.
cases, the
Yeah.
injuries are due to them trying to break out of their crate. So if they're acclimated, we can get that number down even lower. We can get those numbers down lower by preparation. And then also, say if a death happens, and it doesn't occur in its lower numbers, but when it occurs, if you look at the data, you find that these pets had pre-existing medical conditions. So make sure your pet is medically fit to fly. You know, same as when we travel. Say if a person, God forbid, if I had a heart problem and my doctor said, don't fly, I'm not flying, right? So as veterinarians, we need to start reviewing the medical records on these pets, making sure they're actually medically fit and sound for air travel. Because if they've got heart murmurs, underlying cardiovascular diseases, something significant there.
You put them in the plane, stress them out.
And then you have certain breeds. You got your brachycephalic breeds with the snub nose. They don't do well in cargo. And actually, lately, there's been a lot of incidents in cabin with them. They don't do well with air travel, and people need to be aware of that. So, yeah, let me stop there because I can go on and on. But there's a lot that we can do to better prepare pets for air travel, and that's what I want you to do. So you said your golden retriever. I'm sorry, I forgot the name. What did you just say your baby's name?
Leonard.
Leonard. Leonard needs to be crate trained and acclimated to being confined to his crate. We need to make sure
favorite blanket or toy in there in the den.
Well, a lot of airlines will tell you not to put toys in there. Anything that's potentially anything that could be a potential choke hazard, please don't.
So you're not allowed to put their favorites. I will go over a little bit of that. So because a lot of
a shirt maybe that has your scent on it, something where they feel comfortable. And you can also use those sprays. What do you call it? Adaptol spray? What is that? The pheromone sprays. Feel Away for cats. Adaptol. Black some. Put that in there and make
so
it.
So a blanket is okay. A little blanket or something is okay. Yes. Okay. No toys. Nothing like that.
Nothing that potential choke hazard. No, a lot of things people like to do too. Don't put a GPS tracker on your pet. That's no. Anything with lithium batteries, no. That's considered dangerous goods. Don't put that on them. And they don't need it because you don't need it. You don't need it.
With an anxiety that they suffer from anxiety, separation anxiety.
Yes.
Okay. On the vet ahead of time, we have some, or the medication that we use.
No.
We go over that a little bit.
Yeah. Most airlines will tell you that sedation or anything that causes sedation, which is different from a sedative, because if you think about it, there's a lot of medications that can cause sedation. I can drink alcohol and I can be sedated too. So you think about it, there's a lot of things that can cause sedation. So a lot of your anti-anxiety medications, they have a sedative kind of effect. So those aren't, anything that causes sedation is not allowed for to give to an animal for transport. If you get them properly acclimated to being confined in their crate and relaxed, they'll do fine. Look, one person always said that if the pet owner wants to take a Valium, you go ahead and take the Valium so you'll stop.
so we can give it to the pet owner.
If your pet is prepared properly and acclimated and healthy, they'll do fine. They'll do fine.
That's a great advice because a lot of pet owners come and ask me as a veterinarian, I need sedation because my dog is traveling. I was like, no. You have to comply to airlines.
Yes.
Make sure that is allowed. Do not go and sedate your pet,
Doctor, I'm telling you, I've seen situations where, and what pet owners, sad thing is what pet owners would do is, if you give them something for like an anti-anxiety, a trazodone or a gabapentin, they figured if one is fine, they'll give two, right? And then they'll overdose their animal. There was a situation where I saw where they actually, this little chihuahua was overdosed. It didn't even make it on plane side.
Oh.
Because it had an underlying, number one, it had an underlying medical condition.
Yes.
Overdosed it with trazodone, boom.
Yeah, because
You-
probably
do you have to? I think the pet owners have. I know they have the best intentions in mind when they're doing things for pets. I know they do, but they don't sometimes put all it together to understand.
and this is also the veterinarian responsibility. If we're
Yeah,
going
you
to
got to
do
teach them that.
a
Mhm.
health certificate for travel, we
Yes.
want, as provider, as veterinarians, to make
Mhm.
sure we follow all the rules, check the medical history, make sure that pets are safe
Yep.
and safe to travel
Yes.
and medically fit to travel. Make sure we advise them not to sedate their pets.
Right.
So we have to honestly, and we're going to put this on our website on Vetzi.
Yeah.
We're going to provide them with some information on advice. Also, not just on it's on Vetzi AI and the chat, but we're also going to add it on our website too for a reference for every pet owner that needs a quick advice on that as well. And we
Yeah.
will connect them to your website as well too through our
I
website.
love it. We need to team up and really share the information further. So I think
Protect
I'm really excited to work with you on
our,
that.
yes, to
Very
protect our
excited.
pets and educate our pet owners because all what they need education because I know they will do the best thing for their pets. There's no doubt. There's no question about that. But you just need to the right education.
Yes. Tell me. Let's get back on you for a quick second. What's your vision for the next 12 months? What are you planning on doing with that?
Oh my goodness. Basically expand our licensed vet network, the
Mhm.
virtual. We're currently in Florida, so we want to go to every virtual state that allowed us to do a virtual care.
Okay.
And then also we want to expand our collaboration with pet insurance,
I
employer,
was I was
yes,
thinking
shelter,
about that.
especially
Actually,
shelters.
you
Yeah.
know, that's perfect. But I was also wondering in my back of my head, I was thinking too, have you connected with a care credit or something like that? Because everything comes into play if you think about it. Paying for things also is something for them to consider. Because imagine,
Yeah, we haven't connect. We use care credit for our for our brick and mortar practice in here.
good,
This is a great idea if we connect with any employer, any service that
yeah,
provides a pet owner or any of that. They all need our service, like
right,
any pets. So whether through an employer, whether through a credit service, whether through a pet insurance, whether through shelters, for adoption. Like we can help shelters a lot with post adoption care. We can actually lower the ER visits for the rescue, and
right.
that will improve the adoption outcomes. And this is a huge problem that we're facing. So shelters can really benefit a lot from using us. We're like 24/7 supporting them, and they have always a vet there to help them out.
Mhm.
They go to there is a vet available in the all the SPCA's and the Human Society. They close at 2, but after 2 o'clock or 3, I think most of the time after 2 o'clock or 3 o'clock, we can always be there for them. Through our not just and the Betsy chat, but through
Mhm.
also our licensed vets.
No, that's good. No, you've got a good plan. I think you've got
Yeah.
some good things
And
headed
one
for
thing
you.
too, hopefully the Vetsi chat could be in Spanish or different languages as well. So this is some passion of mine. It's not
I,
just for the
you
English
know,
speaking, but for
I'm so I'm so happy we met, and I'm glad to learn about your passions and everything with it. But I'm glad we met because we met at Pet Connect this past
yes,
December
yes, the
2024.
conference.
Very happy about meeting you there. But you just made me think of something that I really believe strongly that I want to do too. Being that you're Spanish, Hispanic,
No, actually, I'm Egyptian, but
you're Egyptian. But I'm
yeah,
saying, you know what I need to do? I didn't know that. I'm sorry. But what I would like to do is, and maybe you can help me get resources for this, but I would
yes.
like to see if a way
We're
that
going to
I
do it in Arabic as well. So this
yeah,
is Arabic and Spanish and
yes,
different
yes,
language because people love their pets. It doesn't matter
yes,
where they are. We're
yes.
all global now. We're all connected.
We,
So
we, we
every like I know what goes on anywhere and in the world. So everybody needs to have an access to good educational pet care. So it's not just the English spoken. Hi, how are you, Greta?
Hi,
Good.
Yeah.
she happens to just grace us. She's gracing us with her presence today.
Oh, so good to see you.
So good to see you. I'm sorry to interrupt the conversation. I had technical difficulties. My computer rebooted. I'm sorry. My internet Firefox um, downloaded updates, and every time it does that, it takes me forever to get back in. It just throws me off. So I'm so sorry, everyone, for
Greta,
being
I
late.
know how technology works. I know how can it get. So I'm really, my platform is one example. So we work on it every day, like glitches, bugs. We have to, so technology is not
Yes.
easy, but it's so important for everyday life. So
Well, Greta, thank you so much. I'm glad you were able to join us, but Greta had us totally prepared. So I'm so thankful for that. It was like, hey, we'll just keep going. Greta already had your questions in the banner. We are all set to go. I think we did things, but we probably because Greta is our resident pet owner that keeps us slowing down, because when you get fellow veterinarians talking, we have this wavelength.
A passion, like
we have this wavelength that we're going, and we have to realize that not everybody is right there with us in our head. And Greta always kind of grounds it, make you say, wait a minute, what did you, and ask the question again. So I hope the audience, I'm sure they got us and everything.
Greta, we're trying to slow down.
Greta gives us, she grounds this whole session a whole lot better. So that's one thing I really appreciate with her being with us. She just grounds it, because we can go on, and I think we did. We did. I'm glad you're here. But yeah, we covered about everything on the banner. And gosh, Dr. Azza gave me an opportunity to share a lot of pet travel education. But again, if there's anything, actually, Greta, is there anything you wanted to ask Dr. Azza and everything? Because I usually have a lot of questions too.
Yes, if you have a few extra moments. So and I apologize if any of this is a repeat to what you already discussed, but I was so curious to know, so I know the app is just getting out, and I believe from what I read, you're just in Florida right now. That's as far as your coverage goes, is the citizens in Florida, correct?
Yes, correct.
Okay, so how I was looking at your app is when pet parents travel, and let's say, everybody travels to Florida. So, if they're somewhere and they run into something, it would probably be a great idea to suggest that people download Vetzi because you are able to at least help with the quick questions, or at least nerves, and also even give next steps to, okay, from where you are, I'm not sure, are you able to say, okay, if you're in Orlando, there's a vet hospital on this block or something like that? Can you give that kind of guidance?
Oh my God, this is exactly what we do. This is like a perfect question. So thank you so much for asking this great question. So yes, any pet owner can have access by logging in and creating an account. Once you have access, you actually can have access by creating an account and being a member, or you can just see a vet, or you can just chat right away. So we're not forcing you to do anything, but there's a lot more advantage if you create an account. But for you to even use our Vetzi chat 24/7, it will guide you. Like if you're anywhere in Florida and you have an issue, it will, if you ask questions and it needs to be escalated, AI would flag it as an emergency, and it will guide you to the nearest ER. We have a built-in ability for referral to our nearby through a zip code. So it will guide the advice to become whether was our online Vetzi, the licensed vets online, or if it needs an in-person visit, then we're going to say, hey, no, it's still 8 to 5, the local clinic, and it's not emergency. You go to the clinics in your area. It's ER in the middle of the night. No, you have to go immediately to ER. So our Vetzi is trained to flag emergencies and escalate it to the next step, like you mentioned. 100%.
That's fantastic. Now let's, of course, you would love to have people be members of Vetzi, but like I said, what if they weren't and they, found out, oh, I remember Vetzi, let me sign up right now because I have a problem. Do they have to wait before they're able to talk to someone, or do you talk to people immediately?
So so our Vetzi chat is trained by licensed veterinarians for over 20 years. So the chat is very specific. And if the chat is not enough, they can get scheduled with licensed veterinarians through certain hours. Like, so they work from 8 to 9 p.m. After 9 p.m., if we think that that to go to our chat, if our chat does not give him enough, they will automatically refer him to ER if it's needed. If they will say, hey, please wait until 8 a.m. when your vet's office is open, it's not an emergency, do not waste your money, do not waste your time, do not stress yourself or your pet, they will do that as well too. So basically it's like, here is like the thing. If if the vet's office is closed and I don't know where to go and what to do, actually join our Vetzi and it will guide you, because we have the built-in referral system. If you want to know if the illness is serious or not, sometimes like it's 7 p.m., all the vet's offices are closed, and I don't know if it's serious enough to take my pet to the ER or wait till the next morning. Our Vetzi chat will let you know if it's urgent or not, or you can wait. If it's like a little weird question and I don't know what to do, I just want to ask and I don't want to pay a in-person visit to ask these questions, you can ask our chat for free. And if the chat cannot give you the answer, it will escalate that to our online vet service without the hassle of going to a costly visit. And then also you get a very quick answer. You don't have to wait for weeks to get to a regular vet.
That's great. Is there anything that the app cannot answer? Like, let's say, for example, the app doesn't know a lot about poisons.
So we have also, we're training the app to do poison control. And also we have all the poison control information. Every clinic, every telehealth have all the information on our website. If it's a poison, we're going to let you know, hey, connect to this number immediately because it's emergency. But we also will give them a couple of advice until they connect. And we have the ability to do that as well. What we cannot do, we cannot give vaccination. I cannot perform surgery on the app. So I cannot pull blood. So, but or if it's ER, God forbid, is like major, cannot breathe, difficulty breathing, bloated, and it needs to go to ER, unfortunately hit by car, this like major issue. Of course, we're going to have our, Vetzi is flagged to direct our client to the nearest ER. So those are the things so we can cover 40 to 50% of the cases and answer a lot of questions and solve a lot of problems online, whether it was our chat or through our licensed veterinary service online. But the in-person thing, we cannot replace that. We still cannot live without them. We collaborate with them. Our job on Vetzi is to fill a gap while they're waiting to see their primary care veterinarian in an effortless, affordable, a quick way. So we're just bridging the gap here. So we're not replacing, we're collaborating. And the beauty about that is our app have the ability to store and share record. So this is how we collaborate with our local vets, is we share the record with them as well. We can actually have the history of the prescription if we're going to prescribe anything. Owners can even fill in, write all the prescription that they're currently on in their medical record as well. So it was just like we're really trying to make it convenient and one place to go there and find all the information about your pet's needs.
I think that sounds wonderful. You're filling the gap.
Okay, that's fantastic.
You're not replacing, you're just filling the gap.
We're not replacing, we're collaborating with every veterinarian out there. It's basically, if I'm not filling the gap, I'm getting rid of me, and I'm a veterinarian. And so we need in person, but we need to fill the gap because that was missing, and it was causing a serious problem and an anxiety for pet owners for after hours. So they're all as important. We all have to collaborate. We all have to collaborate together to empower pet owner. We cannot be stranded after 7 p.m., right?
Yeah, we mentioned earlier that, this was really during the pandemic. That's where the need showed. It was a true need as far as getting appointments and how difficult it was getting appointments for pet owners. But that still exists to this day. There's still difficulty. I don't think there's enough veterinarians working to fulfill the need. So there still is going to be there's always a need,
So Brian, the shortage of vets still. Like we're having a shortage of veterinarians. Yeah. And they cannot be online. They cannot be after 5 o'clock. They cannot be 24/7. Remember, we used to give, and we're probably still doing, because we're passionate and we love our pets. We were giving them our cell phone number. So people after hours, I was like 24, 2 little babies, kids at home, and my dogs and all that. And I'm getting calls after because I felt bad because the veterinary nature, they're compassionate. They went to that school because they want to help everyone. And then they get so overwhelmed and go commit suicide after that because it's just like there's no balance. There's no life-work balance. And this platform can create actually life-work balance for a lot of veterinarians as well.
That's good. Definitely.
And Greta, you can ask away.
That's fantastic. Does your app only help certain animals?
I'm sorry, go ahead. Can you repeat your question?
That's okay. Does your app only help certain animals?
So currently we're focusing on dogs and cats, but as we get more provider to join our platform, any provider, we can have provider that do equine, large animal, exotics, small animals like dogs and cats only. Any provider that have a niche, like have a specialty in something and want to educate their pet owners or bring their own clientele or use our, help our users, that's what we provide. So basically, you can sign in as a doctor, as a veterinarian, and create your own platform, and people will come to you. It's like you're having your clinic online, and you practice what you love every single day without leaving the house, or commuting. Because a lot of retired veterinarians, a lot of people that want to cut down on work days, and our platform provide that for even for vet nurses. As a vet nurse, you can actually, the behavior, nutrition, they can actually join us and become a provider on our platform. So we're not limited to small animal dogs and cats. We are unlimited. We can serve as many, like I said, we were just seeking a lot of providers, a lot of veterinarians to come along and help us and become a member of this. So with a very small fee. We take care of, I mentioned that earlier to Dr. Bryant, that we take care of marketing, logistics, and technology. That's going to be our job. Their job is to go and just educate client and do what they're passionate about. That's all what we want to make sure. Any other problems, it will be our platform managing that for them.
That's great.
That's great. That is fantastic. Well, that's all I had.
That's no problem. Oh my goodness, I'm anytime, even
when do you?
Yeah, go ahead.
One more question. I apologize. When do you expect to grow into other states?
honestly, within the next few months, next 12 months, we're really, because we're set to scale. This platform is very scalable. We just want to focus on our area now until when our provider, it's per state. So we're only going to do virtual care for in the states that allows us to do. So we're going to expand to those states first. But our Vetzi chat, we can any state can do, because the only recommendation and advice, it's we're not prescribing or diagnosing or treating. So we're just giving them a hand, and a knowledgeable, trained hand, not just like a Google uh, advice. We're really trying to make it as specific as possible. We train it, work on it every day. We have an amazing development team. They're trying to really maximize it and make it as accurate as possible.
Oh, that's great.
Fantastic.
Great. Well, there's anything else that you want to
Dr. Bryant, do you have?
No, I was going to say, if there's anything else you want to share, Dr. Azza, for let's see, you were Pet Harmony before. Why was there?
We're still Pet Harmony Incorporation, and Vetzi is basically it's we decided to go for Vetzi. It's for vets. Right. It's for AI. They called me Dr. Z, so I was like, oh, okay, I'm vet and I'm Z, and I'm going to be Vetzi. You know, easy, make it simple. You know, and we're still Pet Harmony. We love that name. We still keep it. That's our corporate official, corporation name. And Vetzi is our chat. Vetzi, it's just easier, quick. People just like it's easier in the ear. So so we kind of adopted that. So we did not forget Pet Harmony. We're still Pet Harmony, but we go our trade name by Vetzi now.
That's wonderful. I was just curious, but no, I'm really happy you came today and shared your information. I think we got a lot out of it today in reference to that. And I'm very interested in your platform to see, who knows, maybe I could do something to assist Vetzi in sharing.
I want you to assist with travel, with how pet owners, like, to assist them with their travel needs and how they get their certificates and all that stuff. That would be amazing. Yeah, we definitely can be of help with that. And I'd like to share your knowledge, because it's amazing. We all need it. Our pet travel was us. We don't want to keep them in a kennel for a month, right? Right. Able to travel, right? So
yeah, like I said, though, they got to be, as I said before, they have to be medically fit for travel. So folks have to remember that. Make sure you check with your veterinarian and ensure they're medically fit to travel. That's number one.
In my opinion, before any pet travel, it needs to have an advice with you, like online advice, like how can we prep, how can we make it a success, how can we make it comfortable for our pet, and how can we make it less stressful on our pet and on us too, because we're so stressed, we're so worried when they're in cargo. We don't know what's going on. But just talking to you with your expertise and how you do it and how to handle it, preparation is everything.
Yes.
And every pet owner need to understand, like, prepare, talk to the expert, and you will make your life easy. And Dr. Bryant is like the official Delta veterinarian. You cannot get better than that, So we're excited. I'm so honored to be on your Facebook Live today. I learned a lot, and then I'm also gonna be on a call for my dog Leonard, who is 3, and I love him so much. And to make sure that the travel plans, even though I'm a veterinarian and I do all that, but I still need more specific information. So it's not just pet owners. Even us as vets, we need to understand more, because we don't understand flights and planes and what can happen, the environment around that. So I'm looking forward when I get ready to travel to talk to Dr. Nelva Bryant and learn from her. And I'm so honored to meet both of you. And I hope I answered your questions. And if please, anytime you want me back, I'm happy to come back and talk about our Vetzi and how you can be a member or how can you utilize it. Like I said, to become a member is free. It doesn't cost you anything, but you can to keep all your medical record. You can have access to information 24/7. Our website is full of information as well too. Amazing provider and veterinarian from hopefully every state from like in the next 12 months. So it will be a lot happening in the platform. So we're so excited.
Good. Well, we're very happy you came and
Well,
shared everything about it.
Before we go, we actually had a viewer chime in. So she did ask, is there a way for clients to upload medical records, which you did answer yes. But then she followed up with to tailor the advice better and for vets to have a better history.
Mm-hmm.
Yes, and so
I think she's talking about the medical record.
The medical record, which is you put on your medical record, and then once you get online with any of our vets, we will talk away. We will make sure the medical list is reviewed, everything review in front of us. We'll talk to the owner. We'll take our time. We're relaxing. We're not stressed out. We're not traveling to a clinic. We will make sure we'll go over all the history, over any questions, whether a weird question or a normal question or abnormal, any questions, because sometimes pet owners like, oh, I don't know if I should ask that.
Right.
But anything, any concern. And guess what? After the visit with the vet, you can have actually an access to text the vet and ask a follow-up question. Because sometimes when we have a meeting and consultation with our vet, sometimes we'll forget stuff. Sometimes like, oh, I wish I just said that and I couldn't ask that. So our platform doesn't cut you off. You become one of us. This is like we follow up with you. I text you to follow up. Is everything okay? Are you doing well? Is your pet doing well? Do you have any other further questions? And then remember, we have a pharmacy online. If we need a temporary refill of medication until you get to your primary vet, we can be able to do that in the states that allows us to do that. So there's a lot we can do now. We used to only do advice and recommendation because the states couldn't allow us, but now we can do so much more for pet owners.
Want to add on here, just add this, Samantha also mentioned
Samantha.
DVM. You know, the interesting thing about, I guess the assumption is that veterinarians, we know everything about our pets, but when we have our own pet, I don't know if you're aware of this, Greta, but when Naya was going through all the stuff I was going through with her, and even though I'm a veterinarian and I have a logical sense of what things here, I also revert back to being a pet owner, and I'm like helpless all of a sudden because that's my baby and everything. So as veterinarians, we have the skill set, but sometimes we get to the point where in an area that we're not familiar with. So Samantha, I mean, there's a lot that veterinarians, we're not taught to do as far as travel and everything like that for your own pets, and we need help. So
Samantha, I was asking Dr. Bryant about the Leonard, my dog Leonard, because I didn't know that part of it. You know, I don't know the environment. Leonard haven't been in a plane. So I'm very concerned and curious, and I need an expert advice. I'm not going to just take him first time on a plane without making sure I know everything before I go. And sometimes we are the worst because we think we know everything and we avoid a lot of steps because we think, oh, we got this. And then we can be in trouble. Our pets can be in trouble as vets. Too. So not just for pet owners, it's for anyone, any profession, with a veterinarian, pet owner. We need to learn how to adapt and acclimate to environment, especially travel or any of that. Yes, absolutely.
Yep. So good. I'm glad you chimed in. That's good.
I think that's true for people. I think that's true for people in general, because we wear a hat. And, when we take that hat off, it's like we just don't know. And sometimes, when I'm in situations, I'm like, okay, I need to put this hat on so I can tunnel all my experiences and knowledge for what I need to face that I normally wouldn't. So I think what you're saying is just common for everybody. It's human nature.
Yeah.
100%. 100%.
But I want to thank you, Dr. Azza. I'm sure this was a fantastic conversation that I wasn't at, but I'm sure we will have to have you back and definitely learn more, especially when you start to expand. Please utilize our platform to help spread the word, because I think your platform is a great tool for both veterinarians and for pet parents.
Thank you so much. And I'm so happy that I was able to be with you guys today. And I'm willing to come back anytime you invite me to. And also, I'm so excited about the travel, especially because of my dog too. So I cannot wait for Dr. Bryant to help us out a little bit. And we can actually put our, her website and her expertise was our website and collaborate. And even train our Vetzi chat on her travel tips, and hopefully she can become one of our provider on pet travel experts, because no one is doing it. So this is very unique, niche that we all need as pet owners, not as a pet owners. Yes,
right,
absolutely.
Right. Well, thank you. I appreciate it. Again, love you being here. We will have you back again,
Absolutely.
And yes, we will figure out a way to work together, because I think it's really important. I love your platform and what you're doing. So I think it'd be great to combine if we can.
Thank you so much. Thank you for having me. I'm so honored to be here today. And then I cannot believe it now. I'm going back to see clients right now.
Yeah. Well, I
hope
you have a light evening, nothing stressful, easy going out and everything.
You're right,
Yeah. All right. Thank you.
That's good. Thank you so much, guys, for your time. It was a pleasure. Have a good day.
You're welcome. You too.
Thank you so much.
Well, everyone, if you want to learn more about Dr. Azza Diasti-Kennedy, please go to myvetzi.com. And hopefully soon, Dr. Azza, you'll join social media so that we can help get the word out even further. And also, people, please sign up, and that is pet parents as well as veterinarians, because this is a platform that is a benefit to everyone. So thank you again all for joining us today, and we look forward to seeing you again on Facebook Live with Dr. Nelva Bryant.
Bye-bye.
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 Oh, darn it. Didn't want her to leave. I don't know who's. Okay, I guess Naomi was maybe that was related to her.